I love it, you
No,
guys.
he doesn't. He's just. Yeah, well, you guys
There we
will
go.
be
That's
able to
my-
come in
that's
and
my
you can
favorite
take a
right
picture.
Usually, usually we put people that way so
Yeah,
that
usually I am the one who puts
go
the
like,
person in the best place.
oh, brother, what are we gonna do with this guy? Don't look at the camera.
you don't want us
Yeah,
looking at the
Don't look at the camera.
Okay, that sounds good. Are
Especially
your
that-
glasses
Can you
clean?
turn that red light off?
Are your glasses clean? Are your glasses clean, you weirdo? Yeah, all right.
I think so.
Oh, golly.
The traditional Thanksgiving food.
Yeah.
We have the turkey, sometimes
Joe's
ham.
a master
Ah,
chef,
no, no,
kind
no,
of.
no, no. I'm
Yes,
a
he
cook.
is.
I'm an okay cook.
He is an okay cook, and he usually always prepares all the food. This year, our son was going to make all the turkey and all the dressings, so Joe was going to get a break.
They're all good cooks, so
Yes.
it's like this is kind
Yeah.
of the passing of the baton. I was really looking forward to it and didn't quite get to that part of the whole
Yep.
day. So it was just a stuffy feeling. There was no fever, there was no nausea. It was just sort of that feeling, well, something's not right. Loss of energy, lethargy, no appetite really. So you have this suspicion that it could be something related to something heart related. But like most men, husbands that are knuckleheads, you sort of say, well, I'll walk it off. We'll see.
I was in the kitchen with my son, and our grandson came to his mom and said, Papa's doing something silly. He's laying on his back in the driveway. And so I knew something had happened serious. And so we ran out, got the ambulance called. My son and I were leaning over him, checking pulses to see wrists and neck to see if he needed CPR. And he didn't. At that point, we could tell he was still breathing. And then just as the fire and rescue got there, his heart had stopped. And so then they started with all of that.
I was the on-call surgeon for Thanksgiving weekend, and Dr. McCasling called me and told me, hey, you know what, we have an aortic dissection here in the emergency room. We need your services. Joe had a unique presentation. He was awake, he was conversant, he was completely neurologically intact, and all of those are really positive things for a really serious problem. I was able to have a nice discussion with Joe and Judy and talk to them about the real risks of surgery and why it was imperative that we got him to the operating room right away.
I think the death and dying part, when we got to the hospital, we thought he would be dead, and they get out of the ambulance and say, nope, he's still alive. Actually, that's when Dr. Merritt showed up, and she came in the room, confident, quick, said, we've got him ready, the room's prepped, we need to go now. She looked at me and she said, this is what it is, it's a dissected aorta. It's very, very serious, but I'm feeling really good today and positive about we're gonna make this, make him survive this. And so we're gonna do our best.
Every hour that a patient is not in the operating room getting that tear fixed, 1 or 2% of them are dying. So again, really important to get to the operating room right away. Without an intervention, he would almost certainly be dead because of what we found in the operating room. We found that it was actually a contained rupture, meaning that all of the walls of the aorta had worn through, and just opening the chest and getting in there to start our repair, the aorta really started to show us that there was a hole in it. We had to control that with our hands and just really get to work. When we call for the operating room in these cases, everybody knows how much the seconds count. And I could not be prouder of our team. On a holiday, Thanksgiving Day, we had 7 people come into the operating room that wouldn't usually be there. And they came without being asked to come. They heard that we had a case like this, and I think it really speaks to the dedication of the team that we had a whole room flooded with people who were there for a common goal of getting Joe what he needed immediately.
The care that he received, it helped us deal with those baby steps of recovery, really from death to life again, and wanting to appreciate everybody's training and talent and compassion to get us to that point.
From my point of view, it turned out great. What you have to realize is the people in the world that care about me most watched me be pretty much dead. It's an earth-shattering realization. And so I owe it to my loved ones to just kind of pay attention and be a better Joe. I would say for my family, they can call this whole thing, Papa's Amazing Thanksgiving Miracle.